Retinol is one of the most popular and effective ingredients you can use in a skincare routine, but there's so much misinformation that surrounds the use of retinol, and I'm going to cover 8 of those misconceptions today in this video and tell you from a dermatologist what is the truth about using retinol. First off, what do we actually use retinol for? They were first developed for the use in acne. We use those most commonly in the clinic for teenage patients that come in with acne. They can help on comedonal acne or inflammatory acne, and in some cases even cystic acne. And of course there's oral forms of retinol, and we are not getting into those today. That's like Accutane, isotretinoin. We're focusing just on topical retinol. It also can help with things like hyperpigmentation, texture, fine lines and wrinkles, and so many other things. And because it's got so many uses, it can be used by a wide range of people. But again, it comes with some myths, and we're going to be clearing those up today. The first myth that I'm going to tackle is that retinol causes skin thinning. Now, this is not actually true. When we look at what retinol does, it actually thickens the deeper skin cell layers, and it can help to improve collagen. Your skin will actually get thicker and more supple with the use of a retinol. It can thin out the very top layer of dead skin cells, and that's what people are usually thinking of when they talk about skin thinning. But if we look at the thickness of the skin as a whole, it's actually going to get thicker with the consistent use of a retinol. So no, retinol does not thin your skin. Myth number 2, maybe a little controversial. Retinol causes increased sun sensitivity. This does not actually happen with retinol. Now, in the initial stages of using retinol, you might have some more sensitivity of your skin in general, and you can be more likely to sunburn. But retinol does not increase your vulnerability to sun damage. So when you're on Accutane, that's a little bit different story. You can definitely be more sensitive there, but you don't need to worry that when you go out, if you're using a retinol, that you're going to be at a huge increased risk of a sunburn. We of course recommend that you take standard precautions to protect your skin with the use of sunscreen, but you're not incredibly more vulnerable when you use a retinol. Myth number 3 kind of goes along with number 2, and that is you shouldn't use retinol in the summer. This is incorrect. Again, if you're using proper precautions, you can certainly use retinol in the summer. We do recommend that you wear sunscreen, and especially if you're in the early stages of using retinol and your skin's a little bit sensitive, you want to protect it, but you're not more vulnerable to sun damage, and you absolutely can use retinol through the summer. I use it year-round. Myth number 4 is that retinol cannot be used around the eyes. Now, there's a little bit of truth to this, because the same retinol that you use on your face probably shouldn't be the one that you use on that thin and more sensitive eyelid skin. The skin around your eyelids can still benefit from using a retinol as long as it is properly formulated for that eyelid skin. You're going to use lower concentrations of retinol, but the mechanisms that happen in the skin still happen around the eyes, and it can help with dark circles, it can help to increase skin thickness, and there's a myriad of benefits available to you by using a retinol specifically formulated to be used around the eyes. And I often recommend in my clinic the Alpha Ret Eye Max from Skin Better Science or the Retinol Correction Eye Cream from Rock Skincare. Now, anybody familiar with skincare in general knows that it takes time to see benefits. And myth number 5 about retinol is that it provides immediate results. Unfortunately, this just isn't the case. You may find some skincare products that really improve the brightness of your skin in a relatively short period of time, but you have to understand the way that retinol works. The retinol molecule has to get converted into retinoic acid inside the skin unless you're using a prescription strength retinol in which it's already in the active form. But that actually has to go inside the skin cells, inside the keratinocytes, and activate certain processes in the cells in order to get the benefits of increased collagen and elasticity. When I'm treating a patient for acne and we're using a retinol, we generally tell them that it's going to take about 6 weeks to start to see that benefit. It is not an overnight, so you do need to be patient. If you are using retinol for things like fine lines and wrinkles and pigmentation, it's likely to take significantly longer than 6 weeks. As long as your skin isn't getting irritated, you should be consistent with your retinol use, using it over a period of several months to really start to see those benefits shine through. Myth number 6, higher concentrations of retinol are better. I know we go back to this. If a little is good, a lot might be better when it comes to lots of different things. However, that's not the case with retinol. When I prescribe retinols in the clinic or when I recommend them online for people to use, you always want to use the concentration that is high enough for your skin to actually see benefits, but not to get irritation. So the most effective retinol is the one that you can use consistently without irritation. So So if you want to go to a higher retinol and you start peeling and flaking, you're actually potentially going to make skin problems worse, and you don't want to go down that road. So if you're using a retinol and it's not causing irritation and you're seeing benefits from it, I recommend sticking with the retinol that you're using. Do not feel compelled or pressured through social media or anybody else to go to a stronger retinol, because the risk of irritation and dryness can increase. Myth number 7 is that retinol cannot be used with other ingredients. Now, there are some ingredients that should not be used with retinol. The most important one to remember is benzoyl peroxide. For many formulations of retinol, including prescription strength tretinoin, you cannot use benzoyl peroxide and retinol together because it will inactivate the retinol and you're just not going to get any benefit from it. There's one exception to this, however. There is a pharmaceutical company that came out with an encapsulated form of retinol combined with an encapsulated form of benzoyl peroxide. It's in a branded formulation called Twinio. I'm not trying to pitch you Twinio right now, but somebody's going to comment that there's an exception here. And so that is the one exception. But in general, when you're using an over-the-counter benzoyl peroxide and you're using any retinol, the risk of inactivating that retinol is higher, and you really just shouldn't use them at the same time. You can use a benzoyl peroxide in the morning and you can use a retinol at night, and that's fine as long as they're not applied at the same time in your morning or evening routine. When you do look for ingredients that can be used with retinol, niacinamide is one of those that can be very helpful, and sometimes niacinamide will also help your skin barrier and make it less likely that you're going to get irritation from the retinol. I've also seen formulations with vitamin C, so there's a number of things that can be included with retinol. And if we look at Remedy for Dark Spots from Dr. Manib Shah, this one also includes salicylic acid. So there are a wide range, depending on how the cosmetic chemists formulate it, of other ingredients that can be safely used with retinol. And myth number 8, retinol is only for acne. Now, this is certainly not true. We've already talked about that it has so many other potential benefits. Acne is just the most common thing that we use it for in the office, but it certainly can be used for aging skin, fine lines and wrinkles. It can be used for pigmentation. It can help with pore size. You're going to see benefits from improved tone and texture of the skin as well. So retinol can be safely used by a wide range of patients and individuals from very young to very old. When we have patients with neonatal acne, sometimes retinol can be used there. And when I have teenagers that are like maybe tweens or teens coming in, 10, 11, 12, 13, and they have acne, retinol is the most common thing that we're going to start them on. When I have a patient in their 70s who wants to improve fine lines or wrinkles, we're often going to recommend retinol. Hopefully this has cleared up some of the misconceptions around retinol, and if it's something you want to start including in your skincare routine, or you don't like the one that you're using now, I'm going to leave a couple of recommendations down in the video description for you that you can try. One of those is my personal favorite that I use every day, called Alpha Ret from Skin Better Science. This one is going to be a little bit more expensive. However, you get 5 months of use out of a single bottle, which when you start to average it out on a daily basis makes it a lot more reasonable. The reason that I like this one is because it is very tolerable. They do use retinoic acid, which is the same as the prescription strength tretinoin. It's just chemically modified to include lactic acid, and it does not require a prescription. If you want to pick that up, you can do that in the video description, but I've been using this one for almost a full year every single night with no irritation. And I've used so many skincare products, I got to the point where prescription tretinoin and many other prescription retinoid medications were just too dry on my face. They caused irritation and I couldn't use them, but I've had no trouble using Alpha Ret and the Intense Alpha Ret, which just has a little higher glycolic acid, so you get a little more exfoliation, still very gentle on the skin. If you guys have questions about retinol or other misconceptions on skincare that you want me to break down, go ahead and leave them in the video comments and I will answer those for you and create new videos for that. Thank you so much for watching, and when you purchase from the links in the video description, it helps support my work to provide free dermatology care to more and more people in my mobile clinic. So thank you, and I'll see you guys on the next video.